Good evening, everyone. Myself, Manohar Prasad Bahandari. I am a leading researcher at the Institute of Clinical and Preventive Medicine, University of Latvia. I'm leading postdoc Latvia project entitled "Study of Relation between Gastric Microbiota and Volatile Organic Compounds for the Early Detection of Gastric Cancer" at the Institute of Clinical and Preventive Medicine itself. And my professor supervisor is Professor Marcis Lea. A little background of the project. Gastric cancer is the fourth leading cause of cancer-related deaths worldwide. It is lacking a reliable, non-invasive screening tool. And the chemical analysis of volatile organic compounds released from the human body serves as a non-invasive tool for diagnosis and monitoring of gastric cancer. And there is a growing interest in exhaled breath analysis for the detection and screening of gastric cancer. VOCs detection in human breath is a promising biomarker detection method for gastric cancer screening. So what happens in exhaled breath analysis? Cancer tissues demonstrate stage-related metabolic processes, and these volatile compounds are produced and are released into the bloodstream and subsequently eliminated from the body through the long alveoli as components of exhaled air. So this exhaled air can be analyzed to detect the volatile organic compounds in human breath. In addition, an electronic nose using the sensor technology is also employed to detect the volatile organic compounds, which is very easy to use, fast and low cost technique. So the aim of this project is to address the correlation between volatile organic compounds and gastric microbiota in gastric cancer detection, and to facilitate the development of a diagnostic test for gastric cancer screening. So the project goal is the investigation of volatile organic compounds released by gastric cancer tissue, gastric juice, human breath, effect of microbiome changes, and identification of breath markers for an early detection of gastric cancer. So here I have highlighted the main objective, that is to identify the relationship between volatile organic compounds from different biological samples and gastric microbiota, and subsequently to develop an easy, cost-effective, and reliable method for the early detection of gastric cancer. So we'll follow these specific objectives or tasks to perform GCMS analysis for the identification of volatile organic compounds in gastric tissue, both cancerous and non-cancerous tissues, and to analyze the GCMS results, to carry out gastric microbiota analysis using sequencing, 16S sequencing, and to perform breath analysis using GCMS from the same individuals, and to correlate GCMS breath analysis data with gastric microbiota composition. And in addition, we will use an electronic nose, artificial nose, to compare the volatile organic compounds in samples with and without Helicobacter pylori, that is a bacteria that is responsible for the infection causing gastric cancer. So this project is divided into 3 work packages. Work package 1, namely GCMS based analysis of biological samples, that spanned for first year of the project, which I have just completed. And work package 2, GCMS based analysis of breath samples in relation to gastric microbiota, spanning from second year to the third year, end of the project. And work package 3, impact of microbiota on electronic nose readings. All the activities of this project are complementary to Horizon 2020 VOCs project, and some activities are the extension of this project as well. Here I have shown the workflow of the project. So we'll be doing a GCMS analysis of cancer tissue and non-cancerous tissue, gastric juice content, and also 16S sequencing for microbiota composition. And we will try to correlate GCMS data with microbiota study. And then we'll do analysis of volatile organic compounds in breath, also comparing H. pylori positive and H. pylori negative groups. And also the analysis of breath using electronic nose. So that will give knowledge about the effect of microbiota on VOCs in breath, and also about the effect of microbiota on electronic nose results. So here I have tried to summarize the work, the tasks that were completed during the work package 1, the first year of the project. So I have tried to make it like quarterly activities, four quarters, divided into 4 quarters. So first quarter, the work started with literature analysis of volatile organic compounds from gastric microbiota, gastric tissues, and exhaled breath for the detection of gastric cancer. And the scientific activities to be performed were determined. Work on the collection of the biological samples, including breath sample, gastric juice, cancer and non-cancerous tissues for GCMS analysis were started. And I started learning R programming meant for data analysis generated from the project. And because of the close cooperation with Horizon 2020 BOGAS project, I participated in the remote meetings of the project. And during the second quarter, collection of biological samples were continued, and work on data analysis and training using the R programming also took place. And I also created R script in R Studio that was applied to analyze the available data set from the breath test measurements. Similarly, the remote project meetings of BOGAS project were attended. In that meeting, the discussion about the forthcoming electronic nose took place, which the device will be used for the postdoctoral project to study gastric cancer and microbiota related organic compounds. And the publicity and communication activity of the project were ensured on the web pages of University of Latvia and the Institute of Clinical and Preventive Medicine. And during this period, I also attended a conference, workshop of the European Helicobacter and Microbiota Study Group, which helped to acquire deeper insight into the microbiota and H. pylori research, its impact on health, and state-of-the-art discovery techniques, all relevant to the postdoctoral project. And third quarter, analysis of recent scientific literature on gastric cancer detection, exhaled breath analysis, and data analysis was done. Biological sample collection was continued, and some activities were limited because of the ongoing pandemic. But data analysis work and training were continued. And despite some delays in work package 1 activities, some of the preparatory work from work package 2 and 3 were carried out. In work package 2, for the microbiome analysis, raw data analysis pipelines were developed in collaboration with microbiologists and bioinformaticians. In addition, potential electronic nose data types and their specifics were identified, meant for work package 3. Including the created procedures into the analysis scripts. Similarly, the project meetings were attended for the BOGAS project, and the reproducibility test of this electronic nose was conducted at University of Latvia. And during the last quarter, the GCMS-based analysis of the biological samples was carried out, and preparatory work for 2 rest of the work packages were started. Similarly, the remote project meetings of the project were attended. So to summarize the work package 1 activities, GCMS-based analysis of biological samples, gastric cancer tissue and gastric juice in relation to work package 1 is being performed, and some activities had to be postponed and which are now being carried out and will be finished by the end of October 2021, that is next month. Data collection, relevant courses and trainings were taken. Deliverable 1.1, that is a set of volatile organic compounds found in stomach tissue and content, and the milestone, necessary information extracted from the GCMS spectra and analyzed. These are planned to be achieved by the end of next month. And since work package 1 was delayed, work package 3 has been started by collecting data and doing preliminary analysis for the electronic nose. That's all. Thank you for your attention.